On this Thursday night, Ontario's billion-dollar boost to test and trace COVID-19. The promise of more tests, plus new rules on who can get one.
The health experts are telling us that we need to be more strategic with testing.
And the pressure to tighten restrictions again. Off the CERB and on to other benefits, how much money Canadians can expect, and the politics over the payments.
We can't stress the urgency of getting this bill through.
The staggering toll of Canada's opioid crisis.
Recovery is not the same for everyone.
2 provinces, 2 different responses. And should we cancel Thanksgiving?
We'll work around, we'll try to be COVID safe.
How to make plans with pandemic protocols.
Global National with Donna Friesen.
Good evening and thanks for joining us. We heard from the Prime Minister yesterday the second wave has already started in parts of this country, and we've reported for weeks on how daily case numbers are on the rise. Now hospitals too are starting to fill up with patients who are seriously ill with COVID-19. Let's start first with the daily case counts. Quebec is reporting almost 600 new cases today for the second time in a week. In Ontario, 409 more people tested positive. Out west, there are 158 new cases in Alberta and 148 in BC. And though hospitalizations are nowhere near where they were in the spring, over the last few weeks in BC, Alberta, Ontario, and Quebec, numbers have started to rise. In Quebec today, 184 people with COVID-19 are in the hospital. That's nearly doubled since the start of the month. In Ontario, the number of patients in hospital doubled from 44 to 88 in the span of 1 week. Hospitals are now sounding the alarm. And in Ontario, where there are long lineups for COVID-19 tests, the government is scrambling to meet the demand, despite knowing a second wave was likely in the fall. Premier Doug Ford promised today to invest $1 billion to expand testing and contact tracing. Ford used to say everyone who wants a test should get a test. Now that's changing. Eric Sorensen explains the new criteria and how it's led to more confusion.
The long lineups, a sober symbol of the state of COVID-19. The virus is making a comeback, and Canada's biggest province has been caught without sufficient testing capacity.
We were at St. Mike's yesterday and we waited for 3 hours and the lineup didn't move whatsoever.
Ontario has now pledged to put $1 billion into testing and contact tracing, but first an urgent new protocol, no longer suggesting anyone get tested anytime.
We know that over the summer when we opened up testing to anybody who wanted it, we did not find cases. So right now we need to focus on people who are symptomatic.
Current assessment centres will now be for those who have symptoms or have had contact with known COVID cases or where outbreaks have occurred. New testing centres, initially at more than 50 Ontario pharmacies, will start Friday and by appointment for people with no symptoms but who are workers, visitors, or others in high-risk settings such as long-term care facilities. And people with no symptoms and no clear risk factors should not be going for tests at all. Infectious disease experts say the system wasn't prepared for a COVID resurgence.
When we opened up the floodgates to everybody come and get tested for whatever reason. But as soon as that surge came, we had no give. And then you start seeing all these lineups at the places people can't get tests.
The province plans to expand testing and is looking at other options, such as saliva tests now being used in BC. But as the number of COVID-19 cases rises sharply, more than 36 doctors have issued a call to reimpose restrictions on non-essential businesses, nightclubs, restaurants, gyms, even places of worship.
And we really need to protect everyone around us by stopping these types of socializing congregate settings.
That is not something the Ontario government is prepared to do yet.
We're doing all these measures to make sure we can keep the economy moving forward. We aren't at that point right now. But again, everything's on the table.
Unfortunately, it is pretty difficult to normalize your economy without first tackling COVID-19.
A second wave was always anticipated, but it has surged quickly, and autumn has barely begun. Eric Sorensen, Global News, Toronto.
The Quebec government has released a scathing report on a private long-term care home where dozens of people died from COVID-19. An investigation into residence Heron found the owners displayed organizational negligence. 38 people died at the home between March 26th and April 16th. Most staff had abandoned the facility after the first COVID-19 case. When health authorities arrived in late March, they found just 3 employees caring for 133 residents. The investigation concludes authorities at the care home repeatedly failed to address shortcomings because of high staff turnover and a lack of personnel. Millions of Canadians who lost their jobs or were unable to work because of the pandemic are still depending on the CERB. The Federal Emergency Response Benefit pays $500 a week, and it's been extended a few times, but it comes to an end this weekend. There is a plan to replace it and transition people off it. David Akin explains what it means for you and how politics will determine how it all plays out.
A new session of Parliament and some new plans to help the 4 million Canadians on the CERB after that program ends. Most of those, nearly 3 million people, will move to a simplified employment insurance program that will see recipients receive a minimum of $500 a week. That's the same as the CERB while they look for work. The government originally had set that minimum payment at $400 a week, but boosted it to match the CERB after pressure from NDP leader Jagmeet Singh.
The help that goes to families that are going to see their CERB ending in a couple of days, that amount of support does not get cut by $400, which is what the Liberals were proposing. We fought and won for people.
But more than 1 million CERB recipients will not qualify for that new EI program. And for those, a trio of new recovery benefit programs. One for the self-employed, one for those who need short-term paid sick leave, and one for caregivers. Those programs, too, will pay $500 a week. Now, the new EI program is already in place. Those changes only required cabinet approval. But the other recovery benefit programs requires approval by the House of Commons. And that's where politics and a minority government come into play.
We can't stress the urgency of getting this bill through. I've worked very collaboratively with my critics. I know our House leaders working with other House leaders.
Now, the government does have a few options to quickly pass the bill through the House of Commons, but it has not said how or if it will use those options. And so it looks like it could be an uncertain week for the million or so Canadians who, after next week, can no longer depend on the CERB. Donna?
David, the throne speech was yesterday. There has to be a confidence vote on it at some point, and the fate of the Liberal minority government rests on that. What reaction is it getting?
Well, not unsurprisingly, it's been a bit mixed. I mean, progressive groups, they like the ambition of national child care, national pharmacare, new targets on climate change, things like that. But in the House of Commons, the opposition was not impressed.
Mr. Speaker, yesterday's Liberal throne speech simply repeated the failed promises they've already failed to keep.
Mr. Speaker, yesterday, once again, the Liberals repeated their promise of national pharmacare. They claim they're paving the way to universal pharmacare for Canadians, but they refuse to commit to public delivery and fail to set out any timeline for action.
And the premiers of Quebec, Ontario, Manitoba, and Alberta, they didn't like this speech from the throne. They say it tramples on provincial jurisdictions. Here's what Alberta Premier Jason Kenney had to say.
That throne speech was filled with, as I say, endless distractions and bright, shiny objects, and was not focused on the central imperative that should unite leaders across partisan and geographic lines, which is protecting lives and livelihoods.
As for that confidence vote in the House of Commons, still not decided when that's going to happen. MPs will be debating the speech from the throne at least until October the 6th. Donna?
All right, David Akin in Ottawa, thanks. There is another public health emergency that is killing more Canadians right now than COVID-19, but it's been overshadowed by the pandemic. There's been a huge increase in opioid overdoses in BC and Alberta in recent months. And as Heather Urix-West explains, the provinces have different ideas on how the crisis should be handled.
The Tierney family has seen the devastation of Canada's opioid crisis up close.
We now know 8 different families that have lost a child to this epidemic.
Compared to COVID-19, Canada's other health crisis has proven to be far more deadly. In BC alone, there have been 1,068 overdose deaths between January and August of this year. Alberta has seen 449 deaths between January and June. That's more than triple the number of people who have died of COVID-19 in those two provinces combined.
We're certainly seeing more toxic fentanyl on the streets. The higher concentrations are being found in postmortem sampling.
It's why BC has worked at expanding access to a safe drug supply, emphasizing a continuum of services, from supervised consumption sites to addiction recovery programs.
As long as I'm able to get there every day, it completely changes my life.
Keegan Tierney has been enrolled in an injectable opioid agonist therapy program in Calgary for more than a year. It gives him a controlled dose of a prescribed opioid each day. But next spring, that program and another one in Edmonton will lose provincial funding.
We've also seen, a move away from funding harm reduction services, which we know are very effective for preventing overdose deaths. We've seen cuts to treatment that's effective for opioid use disorders.
Albertans know that facilitating addiction, as the federal government now wants to do by handing out free narcotics to addicts, is not compassion. And that's why our focus is on treatment and recovery.
Alberta's government says it's in the process of creating 4,000 new publicly funded treatment spaces. But for the Tierney family, that's not good enough.
Recovery is not the same for everyone. This has been a lifesaver for Keegan, for our family, and we are fighting for it.
With lives like Keegan's at stake. Heather Yurex, West Global News, Calgary.
40 days until America votes coming up. The alarming thing President Trump said he might do if he loses. Authorities are pleading for calm so there's not another night like this in Louisville, Kentucky. Violence broke out last night as protesters took to the streets to demand justice for Breonna Taylor. 2 officers are recovering after being shot in a scuffle with the demonstrators. One man has been arrested and is facing charges. On Wednesday, a Kentucky grand jury decided not to charge any officers directly for Taylor's death. In March, police burst into her home as part of a botched drug investigation. No drugs were found, and the 26-year-old was shot and killed by the police. Demonstrators are planning to be out again tonight. In Washington, D.C., what should have been a solemn moment on the steps of the Supreme Court turned into boos and chants against the U.S. president. People shouted, "Vote him out," as President Trump and the First Lady paid their respects to the flag-draped coffin of former Supreme Court Justice Ruth Bader Ginsburg, who died last week. Ginsburg's granddaughter said her dying wish was not to be replaced until after the November presidential election. But Trump is pushing ahead. He's expected to name his nominee on Saturday. And senior Republicans are insisting tonight there will be a peaceful transition of power should President Trump lose that election. They're doing that because Trump said something alarming yesterday when a reporter asked him directly if he will commit to a smooth transition of power. This was his answer.
Well, we're going to have to see what happens. You know that I've been complaining very strongly about the ballots, and the ballots are a disaster.
I understand that, but people are rioting. Do you commit to making sure that there's a peaceful transfer of power?
We want to get rid of the ballots, and we'll have a very peaceful. There won't be a transfer, frankly. There'll be a continuation.
A continuation. The answer should have been a simple yes. It's enshrined in the U.S. Constitution that whoever loses must relinquish the presidency. Trump says all kinds of wild things, but as Jackson Prosco reports, this is something that shouldn't be ignored.
Never has a U.S. president shown such open disregard for an election.
We're going to have to see what happens.
40 days before the vote, and Donald Trump has mounted a full-out assault, claiming it will be impossible for him to lose legitimately.
It's a rigged election. It's the only way we're going to lose.
Refusing to commit to a peaceful transfer of power if he's voted out.
Get rid of the ballots, and we'll have a very peaceful. There won't be a transfer, frankly. There'll be a continuation.
What country are we in? Look, he says the most irrational things.
Historians see something much more alarming: the language of authoritarianism.
All of this is meant to, again,
discount of confidence, to destroy confidence that our systems can work.
The use of mail-in ballots during the pandemic has only increased the odds of a disputed election. Lawyers for both Republicans and Democrats are already duking it out over which votes should count, amidst warnings there may not be a result for weeks.
If the election is close, there might be a lull period in which we don't know who wins. And, I think it's reasonable to be concerned about what might happen in that sort of period.
Trump seems to be preparing for chaos, claiming this election will be decided by the courts, not the voters.
It's a scam. The scam will be before the United States Supreme Court.
The president is rushing to fill the vacancy left by the late Justice Ruth Bader Ginsburg, should he need it for that fight.
Trump is aiming to do what his contemporaries in Turkey and Russia now do, which is to use the institutions of democracy to maintain themselves in power.
But Trump's claims of voter fraud have consistently been proven false. 4 years ago, he claimed that the election he won was rigged without providing any evidence. On Thursday, the FBI director testified that there is no evidence of any coordinated voter fraud campaign by mail or any other means. Jackson Prosco, Global News, Washington.
Nearly 500 retired U.S. generals, admirals, and national security officials now openly say Trump is not equal to the challenges of being commander-in-chief. They are publicly endorsing Joe Biden for the presidency. In an open letter, they say the current president has demonstrated he is not equal to the enormous responsibilities of his office. He cannot rise to meet challenges, large or small. The lengthy list of signatories includes 22 retired four-star military officers, top brass from every branch of the U.S. military, some of whom served under President Trump. The letter goes on to say Joe Biden has the character, principles, wisdom, and leadership necessary to address a world on fire. Still ahead, police in Vietnam raid a recycling operation that might make you turn green. Canada, the UK, and the US are set to impose sanctions on the man who claims he is the president of Belarus, plus several other people. The Allies say authoritarian leader Alexander Lukashenko is not the country's legitimate leader, and they condemn his secret inauguration on Wednesday. Canada says it shows his disregard for basic democratic principles and the fundamental human rights of the people of Belarus. Government forces have detained or driven out the country's leading opposition figures and arrested thousands of peaceful protesters. Hong Kong police have arrested Joshua Wong, a prominent pro-democracy activist. Wong says the arrest related to participating in an unauthorized assembly in October 2019 and violating a pre-pandemic law banning the wearing of masks in public places. Wong was a key figure in last year's pro-democracy protests in Hong Kong that prompted Beijing to impose a sweeping national security law. That law is largely seen as undemocratic and severely restricts political speech. And police in Vietnam raided a warehouse that was recycling something that really shouldn't be recycled. Dozens of large bags were found containing more than 300,000 used condoms. A woman told police they were boiled in water and then dried and reshaped before they were repackaged and sold. The owner of the warehouse said they received a monthly input of used condoms from an unknown source. Next, changing tradition, how to carve up a safe Thanksgiving.
You're watching Global National.
How's this for a dramatic high-angle rescue? 2 window washers in Toronto were saved near the 25th floor of a high-rise after their platform gave way and crashed to the ground. The men had safety harnesses on. They dangled briefly before scrambling onto a narrow ledge. Firefighters broke windows in the building and managed to pull them to safety. Neither they nor anyone on the ground were injured. Well, 6 months into this pandemic, we are approaching another holiday and the prospect of not being able to gather to celebrate it. When the Prime Minister said yesterday we likely won't be gathering for Thanksgiving, he did say we still have a shot at Christmas. Let's hope so. But as Abigail Beeman explains, it's probably wise to prepare to adjust lots of our traditions.
Scalloped potatoes. Scalloped potatoes? Yeah. Probably just seasoned meat in general.
The Wisman family is not letting COVID-19 cancel Thanksgiving.
Life goes on. We as a family get together. We have to work around
the limitations.
My fellow Canadians,
In his address to the nation, the Prime Minister took a hard line on holidays.
it's all too likely we won't be gathering for Thanksgiving, but we still have a shot at Christmas.
A message that didn't surprise farmer Samuel Bertrand, and he had to plan for Thanksgiving turkeys back in July.
We bought less turkeys because we knew that would be less popular. They are younger birds, so they'll be a bit smaller for less people.
Big family gatherings frowned upon, though the finer points of the message seem to vary depending where you live.
It's critically important that when we get together with family, we don't endanger other family members. And so I think we'll have to use our judgment.
I would prefer canceling a lot of those in the next few weeks to make sure that we have a nice Christmas.
Thanksgiving's a great time to get together with your family and your loved ones. We're just asking people to follow the protocol, keep it 10 people and under.
The bottom line everywhere, follow local rules, be safe and smart. Something they're doing at the Ottawa Mission where the need is greater than ever.
We're going to make it awesome and wonderful. And I did hear the Prime Minister's comment, but here Thanksgiving will happen.
It won't be a big sit-down affair, rather Thanksgiving dinner handed out like this. Different, but not cancelled.
The clients, they don't have a lot to look forward to, but one thing they look forward to, and over my 19 years, is these special meals, because it's a sense of community.
Back on the farm, they're already planning for Christmas.
We got the chicks 2 weeks ago, so yeah, we had to make a call.
They bought the same number, but will grow them smaller. And now, like everyone else, they wait to learn when families can come together again. Abigail Beeman, Global News, Ottawa.
And that is Global National for this Thursday. I'm Donna Friesen. Tonight's Here in Canada is near Winnipegosis, Manitoba, northwest of Winnipeg. The name derives from the Cree word meaning little muddy water. We'd love to see your Canada. Please email it to us. And thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.